What are MIGS procedures? MIGS stands for Minimally Invasive Glaucoma Surgery. These procedures currently include iStent, iAccess, Streamline, OMNI, Hyrdus. These procedures are performed on patients with glaucoma to lower the pressure in the eye and prevent the glaucoma from getting worse, but before we would want to do a more invasive surgery such as a trabeculectomy or a mid-valve shunt. The analogy I give to people about these surgeries is the analogy of a sink. So we're trying to lower the pressure in the eye. Imagine the eye is like a sink. There is a faucet that's constantly flowing and putting water into the eye. And then there's a drain at the bottom of the sink that's constantly letting that water flow out. And one way of attacking this problem of lowering the pressure is by working on that drain of the eye. So the natural drain of the eye actually has a filter over it. So imagine a kitchen sink, that filter that we have in the kitchen sink, there is something analogous to that in the eye itself. And what we can do with these MIGS procedures is work on that filter by cutting a slit through the filter or punching holes through the filter or putting metal straws through the filter to allow the fluid to flow past the filter faster into the drain, into the pipes of the sink. One other thing we can do is put some clear gel past the filter into the pipes to clear the pipes out and make the pipes easier to run so fluid can go past into them more smoothly. And by doing all that, by working on the filter, by opening it up more, and by letting the pipes become more clear, the fluid can leave the eye faster and the pressure can come down. Remember, this is all with a natural drain of the eye. With MIGS procedures, you're not creating another drain or another hole in the eye. You're using the existing drain of the eye to lower the pressure. Well, usually these surgeries are very quick. They can be 5 to 10 minutes long. They're sometimes done alongside cataract surgery. Typically during the surgery, you're sedated, so you will not feel any pain, but you will be semi-asleep, semi-awake. You will hear some noises from the machines, you'll see a bright light, but you won't feel any pain again. Sometimes during the surgery, I will tell you to turn your head, or I'll move your head to the side during the surgery, then move it back. Again, the surgery takes about 5 to 10 minutes. After the surgery is done, you will have a patch or shield on the eye, and you'll go home the same day. The next day, you will see either I or another doctor in the practice, and you'll come back a week later for another visit, and usually several weeks to a month later after that. There are some eye drops you'll be using after surgery, and I usually ask the patient to continue their glaucoma drops they were using before the surgery, also after the surgery as well. There generally is not much pain, or if at all, and the vision can be blurry. Usually the vision is not very blurry, but it can be for up to 2 weeks after the surgery. That the pressure doesn't typically come down right away. Sometimes it can, but we wait for an entire month to see if the pressure's really come down after this MIGS procedure.